So good morning everyone, Flor de Lisa Gumahop, and today I will describing the process of birth. So labor is the process of giving birth. Signs that you might be going into labor include the construction that are regular, then start to come closer together, leaking fluid or bleeding from the vagina, the abdominal cramp. So if you have that sign, call your health care provider if you have any of these signs. So even if it's before your due dates, preterm labor can start before 37 completed weeks of pregnancy. So labor happens in 3 stages. The first stage begins with contraction. It continues until your cervix has become thinner and dilated, so to about 4 inches wide. The second stage is the active stage in which you begin to push downward. Crowning is when your baby's scalp comes into view. Shortly afterward, your baby is born. In the third stage, you deliver the placenta. So the placenta is the organ that supplied food and oxygen to your baby during pregnancy. So mother and babies are monitored closely during labor. So most women are able to have a baby through a normal vaginal delivery. So if there are complications, the baby may need to be delivered surgically by a cesarean section. Is childbirth painful? So every woman experience is unique, but most mother would honestly say yes. So childbirth is painful. However, it is a short-lived, and there are many methods to effectively reduce. So the intensity of childbirth pain is women can choose a method that makes them most comfortable and that makes sense for their personal and medical situation. So the first one is the vaginal delivery. So what is vaginal delivery? With no medication. So a vaginal birth without medication benefits both mother and baby. So the microbiome or the bacterial environment is established by birth method. So there is some research that suggests that the development of the infant microbiome is associated with the likelihood of developing allergic. So this is during childhood, but the association isn't clear. Has benefits. So the benefits of vaginal delivery. Infant born vaginally tend to have fewer respiratory problems. So the other benefits of vaginal delivery includes a quicker recovery for the mother and the avoidance of abdominal surgery and the associated risks that come with a C-section. So vaginal childbirth has a lower rate of infection in a shorter hospital stay. So the disadvantage of the vaginal delivery is that a vaginal birth may include tearing of the perineum. So sometimes a vaginal birth may not be recommended for the medical reason. So the second one is the Lamaze method. So what is Lamaze method? Lamaze method is typically known for a controlled breathing techniques, but it includes a number of comfort strategies that can be used during labor. So breathing techniques increases relaxation and decreases the perception of pain. In addition to breathing, other information about preparing for childbirth is covered. So Lamaze is taught in a series of classes attended by both the mother and her partner, so when possible. So the Lamaze method doesn't explicitly encourage or discourage medication, but seeks to educate women about their options so they can make the birth plan that suit their individual needs. So the benefits of the Lamaze method. Lamaze training prepares the mother and her partner with a number of tools to use to get through labor and delivery naturally. So the breathing and relaxation techniques reduce the perception of pain and keep labor moving smoothly. So the Lamaze courses help the couple be prepared with what to expect over the first few days and weeks together. For the disadvantage, learning the Lamaze method takes time, so the couple must plan ahead and attend the classes starting in the second trimester of pregnancy. Lamaze method kini siya kay mag-conclude ka og time kay naman kay kanang atenan yung klase para makabalo ka kung sa mga step o sa imong mga buhaton. So ang Lamaze method kay kuan siya kanang recommended sa mga kanang bag-o pa nga nagka-family or na bag-o pa nabuntis. So the next one is, what is Bradley method? So the Bradley method focuses on the preparing the mother for natural childbirth, coached by her partner. So the emphasis is on being prepared for an unassisted vaginal birth without medication. So the method is taught over 12 weeks along with reading a workbook. So midwives often recommended the Bradley method's preparing classes. In addition, the learning ways to reduce the pain of vaginal birth is the method teaches about nutrition and the other aspect of a natural health. So the benefits of this is the Bradley method is beneficial to prepare parents for unassisted births. The second one is it helps the couple be prepared with techniques to reduce the perception of pain and stay relaxed through a natural unmedicated childbirth. It also teaches the couple about things they need to know to take care of themselves as a new parents and what to expect when the infants arrive. For the disadvantage of for this method, for couples who are uncertain if they want to try for an assisted vaginal birth without medication, the Bradley method might not be the best. So the course and the training take a long time. Couples need to begin classes in the second trimester. So LeMay's method and Bradley method is the same because you need to attend class. So for the new parents, LeMay's method and Bradley method is recommended. So the next one is, what is a home birth? So home birth, it can be a safe and relaxing natural childbirth delivery method for a woman with a normal low-risk pregnancy. Home births are vaginal deliveries with no medication, and a variety of mind-body techniques and preparation methods are used to reduce childbirth pain and promote easy labor and delivery. So home birth are attended by a certified professional midwife or a licensed nurse midwife. So sometimes a support professional called a dawala attends home birth. So this birth professional also work in a birth center. So the benefits of home birth. Many women find it relaxing and comforting to be in their own home environments. So the other advantage include not having to worry about being transported to the hospital while in labor or being transported home after the baby's birth. So di na kakailangan mag-andog sakyanan para maadtog hospital. So having a baby at home means having all of the comforts of home, including snacks and change of clothing readily available. So nanadiya tanan, mga ilisan, pagkaon. So the recovery and transition to breastfeeding can be easy because the environment is comfortable and familiar. So the mother can invite whomever she wants to attend the birth. Many women feel more comfortable with home birth if they need to yell or vocalize. So, bisan pag magsigit-sagit ka dira, okay ra kay naman ka sa inyong balay. For the disadvantage is, birthing assistance such as a water birth tub is desired. This will need to be brought to the home and prepared in advance if the home is very remote or to the weather is bad. So, it may be difficult for the midwife to reach home in time. So, di siya makadali-dalig adto because sa weather. Kung unsa ba ang atong weather ana. So, if the birth plan does not progress normally, it may require transport to a hospital. So, kung na may mga mahitabo nga or something nga mahitabo, so kailangan jud mo adto sa mama sa hospital para safe silang dito. So, for the water birth, what is a water birth? A water birth means the mother goes through some or all of the stage of childbirth in a portable tub similar to a hot tub. So, the baby can be delivered underwater or the mother can get out of the water. Ang water birth kay kanang feel sa mga mother nga kanang ang sakit sa ilang kuan kay kanang mawala kung kini ang ilang pilion sa pagpanganak. So, the benefits of water birth is a water birth is thought to be less painful and more relaxed for many women. It allows the woman to move into a variety of positions that can feel more natural and less painful. So, feel nila nga mawala ang kanang sakit kung water birth ilang pilion. So, the partner can be also get into the tub with the mother to support the delivery. So, pwede mag-assist imuhang bana kung manganak ka. So, the disadvantage of water birth is some critics say a water birth can increase the risk of infection, but as long as the water is fresh and clean, water births are not only the risker and not water birth. So, kailangan kung water birth imong piliun, limpyo o fresh food ang water. So, if the birth plan at home does not progress normally, it may require transport to a hospital. So, kung naa may mga something nga mahitabo, so need jud nimo moadto sa hospital. So, the next are the different types of childbirth methods that available in the hospital. So, women giving birth in the hospital have most of the same option as home birth. So, she has a quicker access to a surgical intervention if an emergency occurs. So, women giving birth in a hospital or birth center have the option to attempt a vaginal delivery with or without medication. So, the benefits of a hospital delivery to readily access the emergency intervention such as a cesarean section. So, advanced monitoring for a high-risk pregnancies. The last one is more pain management option including epidural anesthesia. The disadvantage of the hospital delivery is the risk of a hospital delivery can include a higher chance of unwanted intervention. So sometimes the hospital setting can lead to a rushing through the stage of labor, resulting in a higher chance of insertion of the perineum during childbirth and requiring a cesarean. So, other risks of hospital childbirth in any stay in the hospital include a higher chance of infection. So, cesarean or what we call C-section. In this type of delivery, the baby is born through surgical incision in the abdomen and uterus of the mother. So, C-section delivery method may be pre-planned or can be performed as an emergency and respond to any complication. For the vacuum extraction, a vacuum-assisted delivery involves attaching a soft cup to the head of the infant while it is in the birth canal in a handheld pump is used to create suction to facilitate delivery. The advantage is that this assisted birth option has a lower risk than a C-section or prolonged fetal distress. So the rest of this method include a minor scalp injuries or more serious trauma or bleeding of the head. For the forceps delivery, a forceps assisted delivery means that cured instruments are used to facilitate the progress of the infant in the birth canal. Forceps cannot be used if the infant is breech, but it can be an option if the mother is too exhausted or if the infant has to be delivered more quickly than is a naturally occurring. So that's all for the birth process and the different birthing method.